there are a lot of uninsured people in Kentucky, and they're signing up. Oregon has covered 10% of its uninsured citizens already because of the Affordable Care Act. 10% of the uninsured have already gotten covered. Arkansas, I didn't win that state either. It's covered almost 14% of its uninsured already. That's already happened. And that you've got some Republican governors like Governor Kasich of Ohio who've put politics aside. And they're expanding Medicaid through this law to cover millions of people. Now, unfortunately, there are others that are so locked into the politics of this thing that they won't lift a finger to help their own people. And that's leaving millions of Americans uninsured unnecessarily. That's a shame. Because if they put as much energy into making this law work as they do in attacking the law, Americans would be better off. Americans would be better off. So that's the Affordable Care Act. Better protections for Americans with insurance, a new marketplace for Americans without insurance, new tax credits to help folks afford it, more choice, more competition, real health care security, not just for the uninsured or underinsured, but for all of us, because we pay more in premiums and taxes when Americans without good insurance visit the emergency room. We get taxed. And since we all benefit, there are parts of this law that also require everybody to contribute. They require everybody to take some measure of responsibility. So to help pay for the law, the wealthiest Americans, families who make more than $250,000 a year, they've got to pay a little bit more. The most expensive employer health insurance plans no longer qualify for unlimited tax breaks. Some folks aren't happy about that, but it's the right thing to do. Just like in Massachusetts, most people who can afford health insurance have to take responsibility to buy health insurance or pay a penalty. And employers with more than 50 employees are required to either provide health insurance to their workers or pay a penalty. Again, because they shouldn't just dump off those costs onto the rest of us. Everybody's got some responsibilities. Now, it is also true that some Americans who have health insurance plans that they bought on their own through the old individual market are getting notices from their insurance companies suggesting that somehow, because of the Affordable Care Act, they may be losing their existing health insurance plans. This has been the latest flurry in the news. Because there's been a lot of confusion and misinformation about this, I want to explain just what's going on. One of the things health reform was designed to do was to help not only the uninsured, but also the underinsured. And there are a number of Americans, fewer than 5% of Americans, who've got cut rate plans that don't offer real financial protection in the event of a serious illness or an accident. Remember, before the Affordable Care Act, these bad apple insurers had free rein every single year to limit the care that you received or use minor pre-existing conditions to jack up your premiums or bill you into bankruptcy. So a lot of people thought they were buying coverage, and it turned out not to be so good. Before the Affordable Care Act, the worst of these plans routinely dropped thousands of Americans every single year. And on average, premiums for folks who stayed in their plans for more than a year shot up about 15% a year. This wasn't just bad for those folks who had these policies. It was bad for all of us. Because, again, when tragedy strikes and folks can't pay their medical bills, everybody else picks up the tab. Now, if you had one of these substandard plans before the Affordable Care Act became law, and you really liked that plan, you were able to keep it. That's what I said when I was running for office. That was part of the promise we made. But ever since the law was passed, if insurers decided to downgrade or cancel these substandard plans, what we said under the law is you've got to replace them with quality comprehensive coverage. Because that, too, was a central premise of the Affordable Care Act from the very beginning. And today that promise means that every plan in the marketplace covers a core set of minimum benefits like maternity care and preventive care and mental health care and prescription drug benefits and hospitalization. And they can't use allergies or pregnancy or a sports injury or the fact that you're a woman to charge you more. They can't do that anymore. They can't do that anymore. If you couldn't afford coverage because your child had asthma, well, he's now covered. If you're one of the 45 million Americans with a mental illness, you're now covered. If you're a young couple expecting a baby, you're covered. You're safer. The system is more secure for you, and it's more secure for everybody. So if you're getting one of these letters, just shop around in the new marketplace. That's what it's for. Because of the tax credits we're offering and the competition, because of the tax credits that we're offering and the competition between insurers, most people are going to be able to get better comprehensive health care plans for the same price or even cheaper than projected. You're going to get a better deal. Now, there's a fraction of Americans with higher incomes who will pay more on the front end for better insurance with better benefits and protections like the Patient's Bill of Rights. And that'll actually save them from financial ruin if they get sick. But nobody's losing their right to health care coverage. And no insurance company will ever be able to deny you coverage or drop you as a customer altogether. Those days are over. And that's the truth. That is the truth. So for people without health insurance, they're finally going to be able to get it. For the vast majority of people who have health insurance that works, you can keep it. For the fewer than 5% of Americans who buy insurance on your own, you will be getting a better deal. So anyone peddling the notion that insurers are canceling people's plan without mentioning that almost all the insurers are encouraging people to join better plans with the same carrier and stronger benefits and stronger protections, while others will be able to get better plans with new carriers through the marketplace, and then many will get new help to pay for these better plans and make them actually cheaper. If you leave that stuff out, you're being grossly misleading, to say the least. But frankly, look, you saw this in Massachusetts. This is one of the challenges of healthcare reform. Healthcare is complicated and it's very personal. And it's easy to scare folks. And it's no surprise that some of the same folks trying to scare people now are the same folks who've been trying to sink the Affordable Care Act from the beginning. You know, and frankly, I don't understand it. Providing people with health care, that should be a no-brainer. Giving people a chance to get health care should be a no-brainer. And I've said before, if folks had actually good ideas, better ideas than what's happening in Massachusetts or what we've proposed for providing people with health insurance, I'd be happy to listen. But that's not what's happening. And anyone defending the remnants of the old broken system as if it was working for people, anybody who thinks we shouldn't finish the job of making the healthcare system work for everybody, especially when these folks offer no plan for the uninsured or the underinsured or folks who lose their insurance each year, those folks should have to explain themselves. Because I don't think we should go back to discriminating against kids with pre-existing conditions. I don't think we should go back. I don't think we should go back to dropping coverage for people when they get sick or because they make a mistake on their application. I don't think we should go back to the daily cruelties and indignities and constant insecurity of a broken healthcare system. And I'm confident most Americans agree with me. So yes, this is hard. Because the healthcare system is a big system. And it's complicated. And if it was hard doing it just in one state, it's harder to do it in all 50 states. Especially when the governors of a bunch of states and half of the Congress aren't trying to help. Yeah, it's hard, but it's worth it. It is the right thing to do. And we're going to keep moving forward. We are going to keep working to improve the law just like you did here in Massachusetts. We are just going to keep on working at it. We're going to grind it out, just like you did here in Massachusetts. And by the way, just like we did when the prescription drug program for seniors known as Medicare Part D was passed by a Republican president a decade ago. That health care law had some early challenges as well. There were even problems with the website. And Democrats weren't happy with a lot of the aspects of the law because, in part, it added hundreds of billions of dollars to the deficit. It wasn't paid for, unlike the Affordable Care Act, which will actually help lower the deficit. But you know what? Once it was the law, everybody pitched in to try to make it work. Democrats weren't about to punish millions of seniors just to try to make a point or settle a score. So Democrats worked with Republicans to make it work. And I'm proud of Democrats for having done that. It was the right thing to do because now about 90% of seniors like what they have. They've gotten a better deal. Both parties working together to get the job done. That's what we need in Washington right now. That's what we need in Washington right now. You know, if Republicans in Congress were as eager to help Americans get covered as some Republican governors have shown themselves to be, we'd make a lot of progress. I'm not asking them to agree with me on everything. But if they'd work with us like Mitt Romney did, working with Democrats in Massachusetts, or like Ted Kennedy often did with Republicans in Congress, including on the prescription drug bill, we'd be a lot further along. So the point is, we may have political disagreements. We do. Deep ones. In some cases, we've got fundamentally different visions about where we should take the country. But the people who elect us to serve, they shouldn't pay the price for those disagreements. Most Americans don't see things through a political lens or an ideological lens. This debate has never been about right or left. It's been about the helplessness that a parent feels when she can't cover a sick child, or the impossible choices a small business faces between covering his employees or keeping his doors open. I want to give you I want to close with an example. So, a person named Alan Schaefer. He's from Prattsburgh, New York. And he's got a story to tell about sacrifice, about giving up his own health care to save the woman he loves. So Alan wrote to me last week, and he told me his story. 4 years ago, his wife, Jan,